Good afternoon, Blair Caden. My name is Mihiraa. Let's start the warm-up session. How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education, and advanced practice is on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship, that is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
Importance of communication in nursing.
Communication in nursing is the exchange of information, thoughts, or feelings between nurses and patients, as well as among nurses and other healthcare professionals. Communication is important in nursing because it facilitates the delivery of quality care, and builds trust and rapport. Communication also helps nurses to ensure patient safety, by verifying information, reporting changes, and following protocols.
How to communicate with patients effectively.
To communicate with a patient effectively, you should greet the patient with a smile and their name. This helps to create a positive and respectful first impression and shows that you care about the patient as a person. Take your time, even if you're in a rush. This helps to convey that you are interested and attentive to the patient and that you value their time and input. Try to avoid distractions, interruptions, or multitasking while communicating with the patient. Importantly, explain things as simply as you can. This helps to ensure that the patient understands what you are saying, and avoids confusion or misunderstanding. Use plain language, avoid medical jargon or acronyms, and give examples or analogies when possible. Finally, ask your patients if they understand everything to check for comprehension and clarify any doubts or questions.
Your preparation time is over. You can now start your role play.
Hello Mihiraa. I'm Blair, your attending nurse here today. I can see that you are worried, so let's talk about what's going on. Could you please confirm the reason for your visit?
I'm just worried. My knee doesn't look right, and I'm scared it might be infected. I don't know what to do.
I completely understand why you're feeling anxious. It's natural to worry after surgery, Mihiraa, especially when things don't seem right. I'm here to listen and help you figure this out. Let's start by talking through what's been happening so we can take the best possible steps to care for your knee.
Thank you. I've noticed that the area around my knee is red, and it's been swelling more than I expected. It's also painful to touch, and I'm not sure if that's normal. I just don't want it to get worse.
Alright, I'm glad you told me that. It sounds like you're concerned about a possible infection. Redness, swelling, and pain are things we definitely keep an eye on after surgery, especially for a knee replacement. Have you noticed anything else, like any discharge from the wound or maybe a fever?
I haven't had a fever, but I did see a little bit of fluid coming from the wound a couple of days ago. I wasn't sure if that was something I should worry about.
Thank you for letting me know the details. Alright Mihiraa, based on what you've shared and from what I'm seeing, it does look like there could be signs of an infection around your knee. The redness, swelling, pain, and discharge you mentioned are all things we watch closely after surgery. While it's not always easy to hear, I want to reassure you that infections after knee replacement surgery aren't uncommon. The good news is that when we catch them early, they are very manageable. Now, if we do confirm that there's an infection, there's a clear plan we can follow. Usually, we'll start you on antibiotics, which will help your body fight off the infection. Mihiraa, do you have any specific concerns?
Yes, what might have caused the infection?
Your question is reasonable. Mihiraa, it's really important that we focus on keeping your wound clean and dry to help prevent any irritation or infection. After surgery, the wound is still healing, and any moisture or dirt can slow down that process or make things worse. By keeping it dry, we reduce the risk of bacteria growing in the area, which is key to helping you heal smoothly. To make sure we protect the knee, Mihiraa, it's best to avoid putting any pressure directly on it, especially while it's still sensitive. When you change the dressing, it's crucial to follow the instructions given by your doctor or nurse, making sure it's done with clean hands and materials. This helps keep the area protected and healing properly. In terms of self-care, gentle movement is important. Doing the exercises you've been taught can help keep your knee flexible and your circulation strong, which will aid the healing process. But remember, nothing too strenuous. Also, try to keep your leg elevated when you're resting, this will reduce the swelling and improve comfort. By following these steps, keeping the wound clean and dry, avoiding pressure, and taking care of yourself with gentle exercises and rest, you'll give your body the best chance to heal well. And I'll be here to guide you every step of the way.
I really hope it's not something that will make this harder. How long would I need to be on antibiotics if I do have an infection?
I completely understand your concern. The length of treatment would depend on the severity, but usually, a course of antibiotics does the job, and the wound heals well with proper care. But I don't want to get ahead of things. Your doctor will guide you on the exact treatment if it's needed. My main focus now is to help ensure your wound stays clean and to keep you comfortable while we take the necessary steps.
That makes sense. What should I be doing in the meantime? I'm nervous about doing something that might make it worse.
You're already doing a great job by being vigilant. For now, Mihiraa, the next steps in your care will focus on making sure your knee stays clean and protected while we monitor your symptoms closely. First, I'll clean the wound carefully to remove any potential bacteria or discharge and help it stay dry and free from infection. After that, I'll assess the area again to make sure we're not missing anything important. I'll also be updating your doctor on everything we find today. They might decide if further steps, like antibiotics or other treatments, are needed. But right now, our main priority is keeping the wound healthy and controlling any signs of infection. Before we begin, I want to make sure you feel comfortable with everything we're planning. Are you okay with us going ahead and starting the wound cleaning and assessment now?
Yes, that sounds fine. I'm ready for you to check it.
Great, Mihiraa. I'll take good care of everything, and we'll go from there. Let's get started.